this association with rice and rice rather, and with rice wine especially, I think is interesting because it it contains compounds that act as GABA antagonists. GABA is one of the gamma aminobutyric acid is one of the neurotransmitters in the brain, and it actually has an opposite kind of effect that alcohol does on those neurotransmitters in the brain. So it created a drink that people could probably drink more of and not become sedated and kind of tired or mentally inactive. If taken in very high doses, that particular compound can cause convulsions and things, but together in a rice wine, it creates this kind of balanced effect. And that balance between the kind of effect that say alcohol would have, that kind of sedative, but also at times intoxicating and kind of confusing sort of effect, and the clarifying and sort of sobering effect of chrysanthemum, that tells a lot about its use medicinally. So as early as 1500 BC, the Chinese were using it. And then once we get up to the time of the Chinese medical classics being written down, and the early Chinese apothecaries and herbal materia medica being established, the particular energetic properties of chrysanthemum were defined by the Chinese. So the chrysanthemum, it's acrid. This is sort of acrid, and it's sweet, sweet, and it's also bitter. And in addition, in terms of its energy, in terms of its qi, it's cool. It enters the liver and the lung meridian, and so it has this effect. It has these flavors that it can that can affect those particular meridians and benefit the body. Sorry, I'm kind of jumping around a little. One thing that I wanted to say about chrysanthemum, and it ties in with the Chinese garden, is it is sort of the flower of autumn in China. And so during the 9th month, which is now essentially November, more or less, in China, you'll see chrysanthemums in gardens, potted everywhere. And the chrysanthemum is one of what the Chinese refer to as the four gentlemen, which are the plum, which represents winter, the orchid, which represents spring, bamboo for summer, and then chrysanthemum is the flower of fall. And each of these flowers embody kind of like moral or kind of behavioral characteristics that the Chinese the Chinese literati, I suppose, attempted to embody. And with the chrysanthemum, when you think about the time of year that it blooms in the fall, when really everything else, almost everything else, most flowers have died off, the foliage is being lost. There's not a lot of competition for visual attention in the fall. And then the chrysanthemum produces these large and very elaborate blooms. So it represented this quality of not contending, of not competing and contending, and just kind of waiting until the sort of the dust of competition and strife have settled to kind of present what it is that you have to offer. So in that sense, it also represents vitality and longevity, but especially the ability to kind of wait and just continue to sort of self-cultivate until the time is really ripe. And even after the time when one might even be expected to have anything to present or to show, the chrysanthemum suddenly emerges with all this glory. If you get a chance, I know most of you are probably aficionados of the Lansu Chinese Garden, but if you get a chance, you should go down there now, because there are potted chrysanthemums everywhere, and you can see a wide variety of blooms, everything from the kind of very tiny little blooms to these very large and elaborate, heavy blossoms that need to be supported by sticks and whatnot. So I know that the garden is showing a lot of those. There are something like 20,000 cultivars, like particular varieties of chrysanthemum in the world today. And as such, it's one of the most extensively cultivated flowers in the world. Medicinally, it is, as far as Chinese medical herbs go, it's one of the most consumed Chinese herbs, but just by weight and by volume in China. I was first introduced to chrysanthemum when I was in Malaysia, in Penang, and it was during the summertime there. And every morning I would, at the time I had a research fellowship, but I was studying traditional Chinese art in Chinese diaspora. And every morning I would go and do Tai Chi kind of in the cooler hours, what might pass for cooler hours of the morning. And then after the sun had come up and it was starting to get, pretty hot there, I would go with my Tai Chi teacher and the other students, and we would go to a little kind of dim sum tea house. And the first thing that we would get when we sat down was a pot of pu'er tea with a lot of these chrysanthemum flowers floating in it. So I'm guessing most of you are familiar, but here I have, I've just kind of put some chrysanthemum flowers into some water, and you can really kind of make out the flowers. They're in this nice, they rehydrate, and they come back to this kind of nice state. So if you've ever drunk chrysanthemum tea just on its own, you'll know that it's immediately very refreshing. It's sort of cooling. It promotes sweating, and it's a little sweet. It can be annoying the way the blossoms, the petals can kind of get in your mouth, but you can just chew them up and swallow them, and they're good for you. Before I get to the kind of Chinese flavors and energetics of the herbs, I thought I would talk just a little bit about what we know about chrysanthemum from Western medical perspective. One of the things that chrysanthemum contains that's also very good for you is vitamin A. So most people think, when they think about vitamin A, most people are aware that it's important for our night vision. So essentially vitamin A can be converted to retinol, which is then used in our eyes in order to detect light. So if you're low in vitamin A, you might have poor night vision. Most of us aren't, but retinol can then be converted into retinoic acid. And retinoic acid, which is ultimately a derivative of vitamin A, is very important in terms of immune function. So what it can do for the human body is essentially, as the T cells, which are a type of immune cell, are maturing, their maturation needs to be regulated. There are two main kind of facets that retinoic acid has in terms of regulating the function of these T cells. The first is it helps the T cell, it helps the body to create T cells that are not going to react with one's own tissues. And what I mean by that is it helps to prevent autoimmune diseases from developing. Once a cell line is created that is reactive to our own tissue, we can get any number of autoimmune disorders. Probably the one that many of us are familiar with from grandparents or older aunts and uncles is, and it can afflict younger people too, is rheumatoid arthritis. And so in rheumatoid arthritis, we have the case that the body has become sensitized to its own tissue, and essentially we start to get inflammation and deterioration of the joints as a result of our body's own kind of autoimmune response. But another thing that that the retinoic acid, this derivative of vitamin A, that's here in our chrysanthemum tea, another thing that it does is it actually helps to dampen and control the body's own kind of immune response to any sort of antigenic provocation. So, for instance, if you get a sore throat in the fall, and chrysanthemum is one of the best herbs that you can drink. If you're starting to just get that little bit of a sore throat, it suddenly came on, you were feeling completely fine, and then all of a sudden, kind of out of the blue, you swallow and you realize that your throat is hurting. That would be the sort of indication where you might want to try making yourself some chrysanthemum tea, because from a Chinese perspective, it enters the lung and the liver meridian, and the liver meridian communicates with the throat. And because it's cool and acrid and sweet, it can soothe that pain, and it can kind of help to dispel that wind fire, and it can reduce the pain that you feel in your throat more or less right away. But where I was going with that was the retinoic acid can help prevent the body from responding too exuberantly to some type of viral or even bacterial infection. When you have that sore throat, it's not, it is the case that the viral infection or the bacterial infection is provoking the immune response, which causes the inflammation of the tissues. But the actual inflammation of the tissues, the swelling, the heat, the pain, the kind of dryness that can happen in the throat, those are all the result of your body's own response to the viral or bacterial pathogen. So if you're just starting to get a sore throat, let's say it's just a common cold, I'm not going to talk about COVID at all in this lecture, but if you're just kind of getting a cold or of some kind, you could drink the chrysanthemum tea, and that vitamin A could help. Now, I should say though that the drinking chrysanthemum tea on a daily basis would give you kind of the vitamin A that would give you ample amounts of retinol or retinoic acid. If you're just going to drink it, to kind of help treat a sore throat in that moment, at least from a Western medical perspective, it wouldn't be the vitamin A that was helping you with the pain of the sore throat, because the vitamin A takes kind of a long time for the body to process, and then its effect on T cells and effect on other immune components would take some time to have an effect. But there are other compounds in the chrysanthemum. For instance, the one that has a powerful effect on streptococcus, which would be the cause of strep throat, which is a very nasty sore throat. If you've ever had it, then you can test to the kind of intensity of pain that you get from that. Chrysanthemum contains a compound called chrysanthemin, and that chrysanthemin has an antibacterial effect that's been proven effective both in vivo and in vitro on both streptococcus and staphylococcus, those two bacteria, as well as I think Shigella, which we don't tend to think about that much. But strep, which is a very common cause of painful and even serious sore throat, which can be treated with antibiotics, although antibiotic use only shortens the course of streptococcal infection by about 24 hours, so that the period in which you have symptoms just gets reduced by about 24 hours. It's not like a sort of cure. It's really your body's own immune system that ultimately gets the upper hand on streptococcal infection. But chrysanthemum tea, which contains chrysanthemum, is able to reduce the viability of those pathogens in your throat, and it's very helpful that way. So going back to the kind of Chinese medical use of chrysanthemum, it's pungent and sweet, and then it's also bitter, and it's cooling. One thing that I wanted to say about chrysanthemum is that it wasn't used. If you look at the early kind of Chinese medically used herbs, for instance, those that are described in the Shanghan Lun, you don't really see a lot about chrysanthemum. And it's not until the 14th and 15th centuries AD, when the heat disease school became prominent, that you start to see chrysanthemum being regularly included with other herbs to treat acute illness. And the reason for that, there are a number of reasons for that, but one reason for that is in the 14th and 15th centuries AD, you had these large metropolises in the south of China that had grown up. So during the Northern Song Dynasty, from 960 to 1127, the capital of China was in the north. And then there were invaders from the north that pushed the Chinese capital from the north to the south. And that's when the Southern Song Dynasty began, from 1127 to 1280. And that's when a lot of the commerce and culture and a lot of the kind of focus in China kind of adapted to a more southern climate. You also had these large metropolises with very large populations, and these metropolitan areas were communicating via the Silk Road with places as far away as Europe. And so you had a lot of these epidemic diseases that were, and viral afflictions, these kind of varieties of viruses that were traveling from faraway places, from Europe all the way to the southeastern seaboard of China. And with that, Chinese physicians began to notice that there was a change in the way that diseases were presenting and kind of developing in the human population. One change that they noticed was, and this is a characteristic of heat disease in opposition to what we think of as Shanghan, as cold damage, or more kind of cold affliction disease, is the onset of illness was far more sudden. So when you the type of presentation of illness that's described in the Shanghan Lun, even though there are many examples in that book of people falling ill suddenly, the illness, the kind of the sense that a person was sick, their own subjective sense that they were sick, might take kind of hours to develop. So you can think back to, just from your own experience, I'm sure, you wake up in the morning and you start going about your day and you just feel a little tired, a little off. Maybe you feel, your head feels a little fuzzy. You just don't have as much energy. And over the course of hours, you realize, oh gosh, I'm actually sick. I'm coming down with something. I think I'm coming down with something. I might be sick. And then sure enough, later that evening, you are chilling out and you have a cold. Your nose starts to get stuffy. You have a sore throat, and it kind of develops like that at a slightly slower pace. With a wind heat invasion, that might be like a cold wind invasion picture. With a wind heat invasion picture, you're going about your day, and you get your coffee and you drink your coffee, and halfway through your coffee, you realize that you have a sore throat and it's killing you. And you might not even be able to finish your coffee. It happens in the course of minutes rather than hours. And that's just one kind of earmark or characteristic of wind, kind of a wind heat disease. Another kind of earmark of another chief characteristic, I would say, of that kind of warm disease, of wind heat disease, would be that there's some fever involved. There's an elevation of the body temperature, which is also a characteristic of cold damage disease, of Shanghai disease. But the chrysanthemum is one of its studied effects from a Western medical perspective is that it reduces core body temperature, and it does this by dilating the blood vessels. It dilates the blood vessels in the muscles, and also brings heat from the inside of the body out to the exterior. And maybe more importantly, from a Western medical perspective, it actually dilates the coronary arteries that feed the heart. So it helps to relax those arteries, helps to dilate them. So it brings more blood flow into the heart, which is one of the ways that chrysanthemum is helpful in terms of just overall, human health. Yeah. Let's see. I did want to just kind of talk about a few more of the characteristics of chrysanthemum in terms of a one-being perspective, a heat disease perspective. One of the kind of key features of heat disease is a sense of thirst, which of course, when you drink chrysanthemum tea, you find that it's not just thirst quenching, but one thing that I find about it is when you drink it, it actually makes you want to continue drinking. So for myself anyway, I find it kind of difficult to just drink water. I know that I'm supposed to drink water, but I'll drink a little bit and then I feel, I don't want to say satisfied, but I feel like I don't necessarily want to drink any more water. But with chrysanthemum, it's funny because you'll drink it and you kind of want to just keep drinking it. And almost immediately when you drink it, if I were drinking water that was like just kind of warm like this, I don't think it would make me sweat the way that chrysanthemum does. But when I drink chrysanthemum, I can almost immediately feel the pores on my skin opening up. I can feel the surface of my body kind of warming up, and then the interior of my body up into my throat and whatnot cooling off. Another characteristic of wind heat is restlessness. So when you think about restlessness, it's an inability to kind of concentrate. It might be an inability to kind of remain calm. There's an element of irritability to it that presents, and chrysanthemum there too is it's a kind of a calming, creates greater mental alertness, but it in a way reduces the sort of distracted, restless quality that you might associate with caffeine or something like that. Let's see. Oh, going back to vitamin A, and also just the effect that chrysanthemum has on the skin in general. So I talked a little bit about how vitamin A has the ability to help us with our night vision. Vitamin A is also crucial in terms of regulating the immune response. But vitamin A is also needed for kind of health of our skin. So when the skin cells are maturing from what are called keratinocytes into mature epidermal cells, vitamin A is an important cofactor in the correct maturation of those cells. And so it helps our skin to remain soft. It helps our skin to remain healthy. It can help with wound healing. One kind of symptom of lack of adequate vitamin A, and it's one that some of you may be familiar with, is if you've ever noticed on the back of your arms that the hair follicles contain, or the hair follicles become kind of bumpy. The skin on the back of your arms becomes rough, or maybe you've noticed it in someone that you know, this kind of rough aspect to the skin. That is the keratin around the base of the hair follicles proliferating rather than maturing into epidermal cells and creating, kind of a normal skin contour. It can, if there's not enough vitamin A in the body, those keratinocytes, they can build up and create kind of a hard, stiff aspect to the base of the hair follicle. It's interesting too that it will happen on the backs of the arms, especially. You'll especially notice it there, but you can see it on the legs sometimes too. So chrysanthemum is very helpful in terms of maintaining skin health. I mentioned that it has an effect on streptococcal infections of the throat. And when I mentioned that, I also said that it was antibacterially, antibiotically effective against Staphylococcus. So one of the kind of home uses or medicinal uses of chrysanthemum is you can take these flowers, put them in a cloth tea bag, steep them just kind of long enough, like a minute or two, just long enough for the flowers to become saturated and for the aromatic oils and other elements in the chrysanthemum to emerge from the blossom. And then you can, once the tea bag's cooled off sufficiently, but while it's still warm, you can apply it to infections on the skin. The main one that I would kind of recommend using it for would be a sty or a calazion. I don't know if any of you have ever experienced a sty, but it is very often a staphylococcal infection on the rim of the eye at the follicle base of the eyelash, and it can be painful. It can cause quite a bit of swelling. Oftentimes, it will cause a slightly kind of golden exudate. There'll be like a golden or kind of crusty effusion there. And so you could take this tea bag and simply place it over that sty, and the warmth will help to promote blood flow, but the antibacterial properties of the chrysanthemum will actually penetrate through the skin and help the body to resolve the infection there. The chrysanthemum in general has a real affinity for the eye. So chrysanthemum, if you suffer, say, from red, bleary eyes, let's say you've been up very late, or you've been working very hard, or you're out partying the night before, drinking, and maybe you're exposed to smoke and whatnot, chrysanthemum can be used to treat those types of the symptoms that you would get, the redness of the eyes that you would get the following day. It can actually help to make your eyes kind of bright and clear again. And from a Chinese medicine perspective, it does that by reducing the wind heat that's in the liver meridian. And the liver meridian kind of connects with the eyes and expresses itself through the eyes. So one kind of key feature of liver fire when we see a patient, and if we see these kind of red eyes in front of us, we know that there's some sort of liver fire or wind heat afflicting the liver meridian, and that's when we might decide to use herbs such as chrysanthemum or mulberry leaf, or any number of these herbs that we know can kind of cool and drain fire from the liver meridian. From a Chinese medicine perspective, if you wanted to quench thirst, you would give someone something that was sour and sweet, and that would generate fluids. So if you think about lemonade, that would be a good example of something that's sour and sweet. But if you wanted to create yang and kind of generate a sort of thirst, you would give someone something that was pungent and sweet. So you could think about, do you remember those Fireball candies when you were a kid. I don't know if you ever had those, but they're very hot. They have this a lot of cinnamon oil and sweetness to them. When you would put those in your mouth would water, and you would really kind of get this like unending thirst from it. The other thing that I think would generate that kind of thirst is the bitter flavor. The bitter flavor of the chrysanthemum is it's drying. And so I think altogether that it is sort of the flavors of from a Chinese medicine perspective, it's those flavors that that create the sensation of thirst. What's cool about it is it's cool in energy. So it though it has these other properties, it's going to cool you down at the same time that it's encouraging you to drink more fluids. So it is kind of creating some activity in a sense, and generating some yang, I guess, in a sense, but it's still able to cool the body down there. However, I just want to give a caveat there. There are particular varieties that are used medicinally. So the one that's most commonly used is this smaller kind of yellow chrysanthemum. There's also a white chrysanthemum that supposedly has more of an affinity for the lung. This yellow chrysanthemum supposedly has more of an affinity for the liver, so it's better at treating kind of wind heat or liver fire. But the one for the lung has more of an affinity. The white one, which has more of an affinity for the lung, and it's better for treating kind of lung ailments and whatnot. But I have seen larger blooms of chrysanthemum, even different colors, being used in tea. And as far as I know, you'll want to double check this, but as far as I know, none of the blooms or blossoms are toxic in any way. That said, they may not have the best flavor. You may find that they're not as maybe as sweet as this one is. Maybe they don't taste as good. They may also not contain as much in the way of the kind of aromatic compounds that give chrysanthemum their health-giving effects. So I'd recommend that you stick with the ones that are designated for tea. That said, I believe you could grow this variety of chrysanthemum, here in Portland. I have some chrysanthemums that were gifted to me by the Lansu Chinese Garden a few years ago, and they come up every fall and seem to do pretty well. But yeah, it'd be worthwhile, planting them in the garden and growing them. So all herbs will lose potency over time, but one of the main reasons why chrysanthemum, not all herbs, but definitely your flower herbs, your aromatic herbs, they're going to lose potency over time. And one of the main reasons for that, and one of the reasons why I keep them in an airtight jar, is the aromatic compounds that you can smell. That it's such a distinctive smell. It's kind of it's very sweet and yeah, very slightly pungent. But those aromatic compounds that you can smell, they are evaporating. I mean, they're going up into the air. So if you had this, open to the air, or in just the paper, wrapped in the paper, over time, as its aroma is given off, that same quality is lost from the chrysanthemum. And then in terms of the antioxidant properties, they would slowly oxidize over time just through exposure to oxygen. Many of the flavonols, the flavonoids that are in chrysanthemum that help to scavenge for free radicals when you drink it and act as an antioxidant in the body, those would be lost as well. So yeah, you'd probably want to use, if you bought chrysanthemum, ideally, if you kept it in a jar like this, you'd probably want to use it up in the course of a year. But that said, I'm sure that I've had chrysanthemum hanging out longer than that and made tea with it, and it was fine, So vitamin A is it's a fat soluble vitamin. So all of the fat soluble vitamins you can overdose on. And I just want to just kind of say again today, all the stuff that I'm talking about today should be just kind of viewed from like a discussion point of view. I'm not giving any medical advice. If you have any sort of medical condition or you're attempting to get any kind of medicinal effect from anything that I'm talking about today or just in general, you really should do that with the help of a physician, just to avoid any kind of problems. But vitamin A, it's fat soluble, yes. If taken in large amounts, it can cause illness. It can also cause, birth defects in a child. But the amount that you're getting from chrysanthemum will never reach that level. To get that much vitamin A, you'd really need to either be, you might be able to get it if you were eating, say, some kind of concentrated fish liver oil or something like that. Very concentrated animal sources of vitamin A, you might be able to reach those levels. But if you were to take, a vitamin A from a bottle, where there's an actual dosage there, that's where I think you could easily get into trouble with it. Taken like this, I doubt that there's even as much, vitamin A in here as there is in, say, a carrot or whatnot. But the nice thing about the chrysanthemum is it's completely, what you're ingesting is completely dissolved into the water. So it's very bioavailable. Your body can absorb it. When you eat a carrot, a lot of that vitamin A is bound up with the fiber in the carrot and the bulky material there. So even though you're ingesting it, unless you make a soup or something like that, a lot of that is kind of moving through the body without being absorbed. I thought maybe now we could relate some of the kind of medicinal aspect of chrysanthemum to the Chinese medical classics, which is where I always like to go to when discussing Chinese medical topics in general. So we talked a little bit about how the chrysanthemum enters the liver and the lung channel. And I do think of chrysanthemum, though it has this ability to clear wind, heat from the liver, and it's very good for the liver. I very often think of it in terms of helping with the lung in general. And in the Yellow Emperor's Classic, in chapter 8, when we hear about the lung, it says, that which is the lung, it's the 相辅之官. It's the official of kind of mutual. This character fu means to sort of announce. It's the officer, the official of Shangfu. This could be kind of seen or translated as it's the minister who makes announcements or something like that. But this character here, this Xiang, which is the first character that's used to define the lung, is interesting because it contains two components. This component on the left is wood, and the component on the right is an eye. And early on in the kind of Chinese medical classics, this character was written something like this. I look for my notes. So it was an eye with this wood radical underneath it, or the two were conjoined together. It was also written like this. So in the oracle bone script, this was kind of the earliest script of the Chinese language. The characters didn't have their kind of modern systematized composition. Individual elements would sometimes appear in different arrangements, but they were understood together to contain a single concept. So this notion of the wood together with the eye has something to do with the lungs. And xiang literally means kind of a mutual kind of aspect. So the xiang element, I think, is very interesting when you think about chrysanthemum, because it has this ability to treat the kind of wood fire that would be afflicting the eyes, or help to regulate it in such a way that the heat was no longer kind of damaging the eyes. And when you think about the eyes, the actual eye itself, the white of the eye, so you have the eye and you have the iris, but the white of the eye, which is the part that gets red when there's this wind fire kind of invasion, the white of the eye is the part that's ruled by the lung there. And then the next character, Fu. This character, Fu, which means to announce or to say, it consists of a person, this Ren over here, this person, and then here we have a hand kind of doing something, so this kind of agency. But this part here is very interesting. It originally depicted a field. This would have been a field, an irrigated field or something like that, with a single kind of sprout, some kind of plant emerging from it. This all by itself, this portion all by itself is pu, which is like a sprout or like a young plant emerging, but it's emerging from this kind of cultivated place. And earlier I talked about how for instance, the retinoic acid, which is a derivative of retinol, which in turns is a derivative of vitamin A, which has this affinity for the skin, which is ruled by the lung, and helps with which has this affinity for the skin, which is ruled by the lung, also helps with the differentiation of, or regulation rather, of T cells, to kind of cultivate the T cells that would be active against antigens that are not part of our body, and it helps to restrict T cells that sorry about that. It helps to restrict T cells that would cause kind of autoimmune disease. So it, in this sense, I think that's sort of one aspect of the lung there, where it's this ability to kind of examine this character xiang. Oftentimes, even though it means mutual, it's often seen as like an eye looking at a tree. So it's this notion of inspecting something or examining it. And some of the things that, like the definition that I read in the Chuan Jiezi, described it as meaning when you're selecting a tree for a particular use, you would examine kind of its shape and whatnot before, cutting it down and using it. That's that kind of xiang, that kind of inspection of something. But here it's kind of inspecting something and then allowing something to emerge. So it would be kind of, it might be kind of seen or thought of as kind of looking at what's emerging from the fields and determining what you're going to keep and then what you're going to remove or weed out of there. This kind of 相辅之光. One other thing that I wanted to, there are a couple other uses of chrysanthemum that I wanted to touch on today, because in the future lectures, I'm going to be building on these individual aspects in relation to the classics and to the biochemistry. Is chrysanthemum has this ability to reduce high blood pressure. And it's especially the type of high blood pressure that's caused by liver wind rising or liver fire. So in this type of hypertensive patient, you would see kind of reddish eyes, a red face. The person could easily become angered or agitated. They will tend to be irritable and restless. And the chrysanthemum, from a Western medical perspective, it's been proven to have this ability to increase blood perfusion at the surface and thereby reducing the amount of resistance in the blood vessels. And this then reduces the overall blood pressure, and the heart doesn't have to pump as hard against that resistance. Additionally, of course, it helps to dilate the coronary arteries. So it gives the heart better blood flow so that it can pump more easily. So it helps in both with both aspects of that. Something that is very interesting about chrysanthemum that you might not expect it to do for you is it helps prevent osteoporosis. So it actually increases bone density. And it does this by promoting the effectiveness or activity of osteogenin, which is a cell messenger in bone that tells the bone to lay down, tells the bone tissue, the osteoblast, to lay down more cell matrix and or bone matrix rather, and deposit more minerals there. So strangely enough, drinking chrysanthemum can help to give you denser, stronger bones and stave off osteoporosis. And we'll look at each of these kind of uses of chrysanthemum in the coming lectures and relate them back to the classics in more detail. You don't know if you're, exactly how much you're getting, but I would say if you're drinking it, say regularly, you just kind of make it part of your life, and you enjoy it as a tea. You like the flavor, so it's just something that becomes kind of part of your everyday activity. It might only be like certain times a year, maybe you only drink it, during the summer and the fall. Then you do know that it's giving you some benefit. You are getting some vitamin A. It is having some of these effects in your body. And it's not like you're going to just be living off of chrysanthemum. Everything that you're, kind of taking into your body is going to have these kind of sort of small effects and whatnot. So, if you make chrysanthemum kind of part of your, your routine, your diet, in a sense, you can just know, oh, it's helping me in these ways. And let's say, for instance, you have a strong family history of osteoporosis. You maybe you yourself, you went to the doctor and they noticed that you were starting to show some of the signs and symptoms of osteoporosis. I can't see any harm, say, in adding chrysanthemum, say, to your black tea or something like that. In an effort to give yourself more minerals, in an effort to maybe counter some of the effects that caffeine might have on your bone density and whatnot. But to answer your question in a short way, I think that's one of the reasons, or it's one of the criticisms that Western medicine often levels at herbal medicines in general is they are so difficult to standardize, and we don't know the exact dose of this or of that. But the fact of the matter is, the same could be said very often of the medications that the Western medical physicians prescribe, because in terms of the body's ability to actually absorb those medications, the effect to which each individual is actually they're actually utilizing those bioactive ingredients. It's almost impossible to quantify exactly what's going on in the human body. And I can give you a classic example. When we learn about toxicity of herbs, we learn about their toxicity if they're deadly in terms of what's called an LD50. The LD50 of an herb is the dosage at which a 75 kilogram male adult will die from ingesting this quantity. But the dosage at which out of 100 people, 50 of them will die. That's the LD50, the lethal dose in 50% of the people. So for instance, in the case of apricot kernel, which is toxic because it contains cyanide, I can't remember the exact amount, but there in a child, a large handful of those apricot kernels would be lethal in 50% of children. It's one of the toxic herbs that we learn about. So you don't want to let kids just kind of eat those. But why is it that you have two kids, the exact same size, maybe the same age? One of them eats a handful and dies. The other one eats a handful and goes to school the next day. I mean, there's a lot going on there that we don't understand in terms of dosages and whatnot. So a lot of times when you buy a tea bag, it will be what's referred to as the fannings and the dust from the flowers. So with the whole flowers, you have kind of the best stuff. But you imagine if you had a big, kind of factory type setting where they were drying and packaging the chrysanthemum, there would be a lot of broken petals and non-whole pieces there. And so those are oftentimes swept up or kept. And then maybe the second grade of the material or the excess material they'd have will be ground up and powdered and then used in the tea bag. So I almost always recommend, if you can, using the whole flower, because you'll have a much better quality material, much more reliable quality of the material than if you're getting tea bags where it's already finely ground up and powdered. Because in that case, you really don't know what you're getting, and you may get other parts of the plant that are less helpful and whatnot. I have one of these little teapots. You can set the temperature. I'll set it to 190 degrees, and then I'll just take. This looks like a lot, right? But I literally put probably this much in there. I don't know if you could see. I'll put it in this little dish. I put about this much. It's so hard to show here. I'll tip this a little. About that much, I don't know. What is this? Like two tablespoons or something like that. It just grows and expands in the water pretty dramatically. So these little flowers, after about 15, 20 minutes, become these kind of large blooms. And if it does get annoying, especially as you get towards the bottom of the jar, you get a lot of these like little chrysanthemum bits in your mouth, but you can just chew them up and swallow them. They're kind of nice. They're kind of sweet. And they have a demulcent effect. So they have polysaccharides in them that help to kind of moisten and soothe if you say have a sore throat. And they can also, when you chew them up and swallow them, they can also help to treat dryness and heat at the other end of the alimentary canal. So if you suffer from constipation due to dryness and heat, those same kind of demulcent kind of gel creating that soluble fiber that's in the flower petals can help with that type of constipation as well, especially if the liver heat is something that's afflicting the large intestine there. If the person were suffering from any kind of cold illness. So if they had a kidney yang deficiency or even a liver yang deficiency, where there's yang deficiency or cold, you would want to avoid cooling herbs that would enter the meridians that are afflicted by that type of cold. So if the person has a wind cold invasion, you would not prescribe chrysanthemum for that because chrysanthemum is cooling. And it's one of those reasons why it's important to distinguish between, say, wind heat and wind cold. In both cases, you'll have fever, but with wind heat, you're going to have a very sudden onset. Like I said, you'll have the redness of the eyes. You'll have I was fine, and then I had a sore throat type of aspect to it. And there may be, with any kind of wind invasion, there may be aversion to wind or aversion to cold. But with wind heat, there's going to be a greater kind of predomination of a feeling of heat and also actual fever. So the temperature will actually be raised. So it may only be slight. It may be that, say, normally your temperature is 98.2 degrees, and you take your temperature and it's 98.8, which doesn't seem like a lot. But in addition to all of the other kind of aspects of your illness, it can help to understand that it's wind heat rather than wind cold. Another thing that you would look for, that the tongue coating in wind cold invasion, it tends to be white. In wind heat, it tends to be yellow. And then there will oftentimes be a reddish aspect to the tongue, and the tip can very often be red. That shows that there's heat in the upper burner. The pulse too, it'll be floating because there's a wind invasion, but it will be rapid with wind heat, and it will actually be slowed somewhat. Even though it'll be a floating pulse, there'll be a slowness, a strength and intensity, but a slowness to the pulse when it's a wind cold invasion. Hopefully this served as a good introduction, and then in subsequent lectures we can kind of go more into the these kind of individual kind of activities of chrysanthemum, and look at how what's said about it and the way it's used in Chinese, in the world of Chinese medicine and the Chinese medical classics, relates to our kind of modern biochemical understanding of the herb. So I want to thank everyone who attended the lecture today. Thank you.